Amen. Welcome back. You're still watching EKSE right here on Cape Town TV, the People's Channel, and we are serving you nothing but the best dish of entertainment from now up until 5 p.m. So make sure you keep it locked, and also connect with us on our social media pages. On Facebook, we are EKSE, on Cape Town TV. On Twitter, we're at EKSE_live. In Utilising, it is a YouTube, let's say, up and running too. All you need to do to find your favorite EKSE episodes is to go onto our YouTube, click subscribe, and you can find some of your favorite episodes on there. Or even if it's interviews that you missed or interviews that you want to rewatch, especially when it comes to information and education and entertainment and everything that's there, that's available for you, we have it on our YouTube. Now, we are still living in a pandemic, and we don't know if the pandemic is going to last a couple of months, a couple of years even, and everyone is just scared. And there's a lot of misinformation going around, people are being misinformed, people are panicking, people are not educated when it comes to, the COVID-19 or the pandemic and things like that. But one of the projects is called 750 AMP, and they are doing work in and around communities, to inform people more about, the COVID-19, give them correct information and things like that as well. But we're going to find out more what it is that they do. On Skype, we have the beautiful co-founder, or founder rather, of 750 AMP, and she goes by the name of Nondumiso Bulunga. Nondumiso, how are you doing?
I'm very well. How are you?
I'm awesome. I'm just glad we have you on the line today. And I must say, you're looking very, very amped for someone who does your kind of work. You see what I did there?
I see that.
Tell us a little bit more about 750 AMP and how everything actually started and why everything started.
Okay, so 750 AMP is a national campaign responding to the misinformation and lack of knowledge around COVID-19. Yes. It's basically 750 stands for 7 days of the week we're fighting the corona, using five standing for 5 basic measures. Wow. And the 0 is the journey towards 0 infections.
Wow.
And we're using 750 learners that are going to be trained to provide this awareness in socially vulnerable communities.
Yeah. So in more kind of detail, what is it that you're going to be doing? Are you going door to door? Are people coming to a community wall? Or, how are you guys going to be going around and giving people the correct knowledge when it comes to the COVID-19? Because a lot of people are scared, and a lot of people, like you say, are being misinformed all the time. So what is your play? What is your plan on actually doing this and giving people the correct knowledge?
We plan to go around the socially vulnerable communities and places where people have gathered. So be it where people are picking up food parcels, your shopping malls, your shopping centers, that's where we plan to be. Even in taxi ranks to somewhat extent, because that's where people are commuting, and that's where you could possibly be able to inform people. So with the 750 learners, they'll be on ground as a random selecting someone and then speaking to them on the 5 basic measures. Yes. So that they can keep protecting themselves and they can keep understanding, social distance and how the COVID-19 spreads amongst people if we don't practice a different sort of human behavior that we need to develop. Yeah.
And tell me, are you guys only working in the Gauteng province, or are you kind of going right across South Africa and informing different type of communities?
It's right across South Africa. Currently, it's 5 provinces that we are going to be on ground on. It's five provinces. It's Western Cape, Free State, Gauteng, KwaZulu-Natal, Free State, I've said, Eastern Cape. Oh. So in Western Cape, there's various locations we're looking at. Those locations vary from Khayelitsha, Nyanga, Langa, and so forth. In total, it's 45 locations that we will be on ground doing the activations, letting people know about the campaign and how to do basic measures, basically, to prevent themselves from the spread of COVID-19.
Yes, I love that, man. And when it comes to the campaign, and we talk about how the campaign actually started and why it started. And I feel like that's always an important conversation. because we want to know why did it start, you know? Did you just wake up and be like, I'm tired of these lies everyone's feeding? How and why did everything start for you guys?
It started when the president was announcing the lockdown, and we realized that the people who are commuting in taxis are the ones who are then going out into these socially vulnerable areas, and perhaps they can't practice social distance, and they areas where they stay and it's highly populated. So we thought that it would be good to go out to those areas and let the knowledge be spread in that way, because some people are locked down, they don't know what's going on, and they're misinformed about the actual virus. So that's how it all started, in terms of looking at taxi ranks and going out where people have gathered and looking at that.
And I feel like it's more dangerous now to be misinformed than any other time, because misinformation has been around, you know, for quite some time. I mean, we all know Judas, he's been around, but now being misinformed, I feel like it's more dangerous now, because a lot of people are saying, you can do this, you don't have to wear this, you don't have to go there, and things like that. Why is that, and what are some of the misconceptions, you know, when it comes to the coronavirus, especially the pandemic, you know, and what to wear, what not to wear, things like that? What are some of the things, the main things where people are being misinformed by?
I think in terms of how it's transmitted, a lot of people don't know how you can actually contract the virus. So one of our teachings and one of the learnings that we are doing for the learners to go out and empower them is to provide a strong awareness around, if you're feeling a temperature, or if you're feeling a fever, what does it mean? Who do you contact when you're feeling these things? How do you contact someone if you have symptoms? Such things. It's mostly around the transmission and how one can contract COVID-19.
For the people who are not in the 5 provinces that you mentioned, however, they still want to, you know, kind of be informed, be updated, and just check out what it is that you guys do. Is there a certain website, you know, that they can go onto and still kind of get information, or get, you know, what it is that you guys are offering, the services and information?
Yes, we have Twitter, Instagram, and Facebook. We are 750 amped on all our network, on all our platforms. We have a website, www.750amped.co.za, and they can get a hold of us. We have a hotline number. It's 078 653 5517.
I love that. Now, I do know that you guys will be running for about 6 months. Is that correct?
Correct.
What happens after the 6 months? When the 6 months is finished, are you guys still going to be, you know, out there still informing people about? Because we don't, like we say, we don't know whether or not the pandemic is going to last 6 months or 6 years or things like that. So what happens comes the end of 6 months?
So we're partnering with other stakeholders on ground in different locations so that we can continue and spreading the message and spreading the word. And further training perhaps of other learners could come about. At this point, we don't see how that will be done, but after the project, if there's a lot of responses that we get in, because you must understand, they'll be trained in their local language, so it will make it a lot more easier for someone. But it may not reach the other provinces. And if there's a need to do that and further work can come from that, then we partner with stakeholders and municipalities or local councils so that they can further continue the message and train others and provide the awareness and information that needs to go out to communities.
Yes, I love that, man. And if I'm a learner in Free State, Western Cape, Gauteng, and I actually want to be part of the 750 Amped campaign, you know, I want to help out, you know, I want to be one of those people who are going to the different communities to inform people about, especially when it comes to misconceptions and that. Is there certain requirements? Do I need to be matric, grade 7? What are the requirements, and is there certain tests that I need to do? And tell us more about the training program.
Okay, so we do have 750 learners currently.
Mm-hmm.
Although it keeps changing, there is room for others who want to come onto the
Okay.
project. So if they can get in touch with us on our social networks or on our email, which is inquiries@750amp.co.za, we will then be in touch with them, and that's how they can get a hold of us.
Mm-hmm. Perfect. So there's no requirements for the 750 that you chose already.
There is requirement to at least a matric. The ages, we're looking at youth. So the whole thing is to empower youth and utilize the youth in this time of the crisis.
Mm-hmm.
So that youth is between 21 to 30. And we would then do the training, and we provide tablets for the learners to then be able to go on to the training that's provided. That's just the basic requirements. And obviously your proof of address is important, where you stay, that you're close to the locations where we're looking at, and you must obviously then be South African.
Wow, I love that, man. And you guys are doing amazing work, and I feel like this is the time when we need people who are dedicated to keeping us informed, keeping us, where the knowledge is, and telling us, look, this is the stigma, don't follow that, this is what the truth is, and things like that. So we do want to thank you guys for the work that you are doing, and also taking that initiative, saying that we want to help, South Africa, like you say, from the number we are now, or even where we are going to zero, because that is very important. I want to end off on a light note.
That's true.
I want to know from you how lockdown has been treating you.
The lockdown has been interesting, actually. At first, it was a real lockdown where you shut down, don't go out. And then when the project started, you needed some sort of planning and going into the office and doing work. So, we've been working and doing our best to make sure that this project is successful. So it hasn't been that all bad, but there's been a lot of learning that has come through in this lockdown period.
I'm glad. Well, thank you so much again for taking the time out and chatting to us. We really do appreciate it. And we want to thank you again from the whole EKSE family for starting the initiative, doing what you do. And we do wish that you guys go from strength to strength and continue after the 6 months. And just hopefully one day we can have you guys in studio, when everything is done, when we're back to partying and back to, well, not maybe all the way, but, more back, but still sanitizing and things like that. But thank you so much, man.
Thank you so much, and thank you to your viewers.
Awesomeness. Listen, we're going to take a quick ad break. When we do come back, we have more for you. This is EKSE, taking you all the way till 5 p.m. Keep it locked.